This time, we will go to our key focus for this episode, our next segment, the must, where we will talk about current issues. And for our episode today, we will talk about this pressing concern that is in everyone's mind, the COVID-19 vaccine. Ang daming agam-agam, ang daming tanong, ang daming gumugulo sa isip natin. We read a lot, we hear a lot about this COVID vaccine, and we will use the next 30 minutes of our show to shed some light on the efficacy and the effectiveness of the vaccines that we read about in the news. We are blessed because we have two experts who will answer our questions on this very important matter. But before I introduce them to you, I would like to invite you to post your questions or comments in the chat, in the comment section, Facebook or wherever you are, or YouTube. Do send in if you have any questions, and we would love to, share it with our guests so they can answer that. Let's start with our first guest. I will introduce our first guest, Dr. Lulu Bravo. She's the Professor Emeritus from the College of Medicine, University of the Philippines, Manila. She's the former Vice Chancellor for Research and Executive Director, National Institute of Health, University of the Philippines, Manila. She's the President of the Immunization Partners in Asia Pacific, or IPAP, Executive Director and Founding President, Philippine Foundation for Vaccination. Friends, let's welcome to the show, Dr. Lulu Bravo. And I will proceed to introduce our next guest right away. Dr. K. Recto is an MBA graduate from the Ateneo School of Medicine and Public Health. Well, she is a medical doctor by training. Care wears both her medical and MBA hats constantly because she's part of the strategy and external affairs team of Ayala Healthcare, or AC Health, over the past 3 years. In light of the past year's pandemic or COVID crisis, she and her team have been leading AC Health's COVID-19 initiatives within and outside the Ayala Group. Friends, let us welcome to the show Dr. K. Recto. Thank you so much, Dr. Recto and Dr. Bravo, for joining us this afternoon. We are so honored you are with us. And thank you, because you would help us understand more about this COVID-19 vaccine, because we only have 30 minutes. Let's get right into it. And I invite Dr. Bravo to answer us first, and then of course Dr. Recto, that the global issue on managing COVID-19 pandemic has opened doors for I think 100 pharmaceutical companies, and the race to develop the vaccine has spurred so many questions. Some questions, I think for me at least, I have a lot of questions that I don't know if I'm getting the right answers. Can you tell us more about how this vaccine is developed, and what do we mean by clinical trials? Dr. Bravo?
Okay, that question alone will need one whole day, Joanne. Clinical trials are done on drugs and vaccines. As you said, are 200 vaccines under development by different companies, not 100 companies, but 200 vaccines are under development. About 150 of them are still on the preclinical phase, meaning it's on the animals, it's in the lab, and about 50 to 60 are on human trials. And for every 20 vaccine under development, it is expected that only one may be able to make it to the commercial. And this is only for those with human trials already, because it needs to be done with checking on the safety concern at each step of the way. And based on what the animal studies are, many of them will be thrown out before it gets into the clinical and human trials. And during the human trials, as I said, there are about 50 to 60. And right now, there are about, let me see, for emergency use authorization, there's the two are given in the UK, that's the mRNA vaccine and the Astra vaccine. And in US, it's both the mRNA and the Moderna vaccine, the Pfizer vaccine, and also I think the Astra vaccine is on the pipeline. For the other countries, like Russia and China, they have actually given licensure for emergency use for their Chinese the China vaccine and the Russian vaccine. But let me be clear. When you say emergency use, it doesn't mean that it is for commercial use and you can buy it when you wish. Because when you say emergency use, it means only a government to government purchase for countries, and you cannot just want to buy it if you want it. And besides, with 7 billion population in the world needing the vaccine, and there will only be about 1 billion to at most 2 billion a year that will be manufactured every year, the big scramble is on, and the competition to get the vaccine is really on. The Philippines, unfortunately, not being a rich country, are in the bottom line of the list of those who will be given the vaccine. So with that, that's only a kind of scratching the surface.
Thank you so much, Dr. Bravo. And I think we should invite you again. We would love to, talk more about this, given it's really a very important topic nowadays. But I'd like to go back a few sentences when you said about, trials. And I would just like to ask, because I read about in the papers, in the news, about vaccine efficacy and effectiveness. I'd like to go to Dr. K. Rector. Dr. K, what is the difference between the two when we say vaccine efficacy and effectiveness?
Thank you, Joanne, and hi again, Dr. Bravo, and to everyone who's here in the call. I guess in very, very simple terms, we'll start off with efficacy. With efficacy, it's being able to see if a vaccine is able to reduce the chances or the chances of somebody getting the disease amongst a total population of people who are already vaccinated versus another group who did not get vaccinated. But the main difference between efficacy and effectiveness, however, is that in efficacy, it's still under controlled conditions. Kumbaga, nasa laboratorio pa. Things are standardized. The population is typically a healthy population. So you're really able to see and monitor the effect of the vaccine being tested itself. But in effectiveness, that's when you throw the vaccine in the real world setting already, where there's so many other factors, the population, some of them are healthy, some of them have other illnesses, underlying conditions. So that will be the main difference between efficacy and effectiveness.
I see. I see. Thank you so much, Dr. K. It's important for us to have an understanding of that. Having said that, no, Dr. Bravo, if we are going to choose a certain vaccine, what should be the standard then? How do we know that a certain vaccine will work for certain types of people? So especially now that our HR leaders are working in their organization, trying to determine. There are some companies who have, started to decide that they will provide the vaccine for their employees. With that decision, what should be our standards? What should be our guide in choosing a certain vaccine? Dr. Bravo?
Actually, Joanne, that's a very difficult question to answer. And even I myself will not be able to decide, should you be given all the array of vaccines, which one will you choose? In fact, we can debate all night long on which one will be the best for you. And you can have all the experts saying this or this one is more advantageous than the other. Because in the long run, you will have to look at all the clinical trials that have been done on this vaccine. Clinical trials are not the same for every vaccine that you will get. Dr. K mentioned about efficacy being done in a kind of controlled environment where you know what your population would be, the age at which you're going to give it. Are you going to give it in young people or in elderly people? In those with heart diseases or diabetes, or in those who are healthy? So you cannot just compare one efficacy number to another until such time as a scientist or someone who have not gone through these clinical trials. You will need to really look at the different details of the clinical trial. And not just because something is 95 and something is 78 that you will say, okay, 95 is good, I will take it. No way. Because you will have to go through a lot of factors. For example, stability of the vaccine. Okay, let's not talk about safety and efficacy because that's really more like, as I said, clinical trial and scientific. But let's look at the more simple ones like temperature control. We want a vaccine that will be easily deliverable, meaning to say you don't need a minus 70, an ultra low temperature that at one moment when you deliver it could go wrong because you don't have the necessary storage facilities nor the way that it will be delivered or the way that you will be uh, using it is also difficult. For example, you will need a multiple dose, like 10 doses, versus one that is just simply 1 or 2 doses. Because the way that you will have to give it is will be prone to some contamination if there are multiple doses. Or the way that you will want the vaccine to be stored in a big area because we might not have those exact facilities. So it's not easy, and that is the reason why the government has come up with a bevy of experts. And
Mm.
our goal is always, and this is my message to each and every one. I've done so many talks, and I never say no to any talk that will inform people of the right information because my message is always listen to the experts. We
Mm.
know how difficult it is with all the misinformation, with all the disinformation, which is worse, and all
Yeah.
the fake news, and all the controversies, and all the conspiracy theories, and everybody coming in to say something. Sometimes it's difficult to say, get the wheat from the grain or something like that. It needs a vigilance. It needs some form of discrimination. And so we have to listen to the experts. And now I am so happy to say that our Department of Health in the last 1 year have really come up with a whole group of experts. And so when you come out and talk to us, or well, I'm one of those members. There are about almost, I would say about 80 of them now, which used to be just, in the academe, in business, or in science and everything else. Now there's a whole bevy of them coming in and working together and really helping our people, our government, to come up with a good vaccine for us. So listen to the experts.
Yeah,
That's
actually,
exactly what I was gonna say, Joanne. Sorry,
go
that
ahead, Dr. K. Go ahead.
there's no straightforward answer, and really, there are a lot of factors that play into deciding what what is the right vaccine for us, and that's why it's important we look to our FDA, to our DOH, in being able to look into all of these factors. It's not even just on an individual level. Now, is this safe and effective, which I'm sure is the baseline question we all have, but all
Yes.
the other parameters, diba? I mean, it's being able to bring in the vaccine, store it properly so that under that controlled condition, the vaccine is kept effective
Mhm.
in being able to distribute it. But I guess on a personal level and for the benefit of the people here, it's really the safety and efficacy of the medicine that we're looking into, and that's why I think much of the reports today, is really all about that efficacy number under a certain condition, and also understanding the profiles of how these clinical trials were done. I guess I don't want to get ahead of ourselves, but the vaccines today for COVID are still specific to adults. Unfortunately, right now there's still limited information on how vaccines can be effective for children. So that's an important thing to factor also. What are clinical trials focused on today? It's still the general population, perhaps those immunocompromised and maybe essential workers as well. And that's why we will need to factor that into who will get the vaccine first, later on amongst ourselves.
Wow. Okay. Thank you so much for that. To be honest, ako mismo, sometimes I just avoid na from reading anything because
Oo,
as
madami talaga. Oo.
oh, is ang dami. Tas, and I agree with Dr. Bravo, misinformation. And sometimes I doubt myself na rin, am I going to the right source, no? So, and there's one comment here, the best takeaway is in discriminating. And I invite all our viewers to do send in your question. If you have any questions, let us know. And we have the experts here, Dr. Recto and Dr. Bravo, sharing their insights about this very important because a lot of business leaders are really coming together now and discussing how they can provide for the employees because at the end of the day the business leaders are also really finding ways how they can revive the businesses that has been very badly affected by the pandemic. So we're not talking about how can we revive, and of course one of the ways is really, can we have access to the vaccine. And I love that Dr. Bravo mentioned about accessing the right information, going to the right source. Having said that, what do you suggest now that HR and business leaders are really have these questions now about what do we do? How can we support our employees? How can we, make sure that we are protected? What do you suggest for them to do at this point in time?
I guess we have to look into the rollout of the vaccine and really study what the government has done for the rollout. Because, as you said, the business sector is really trying to open up our economy. There is really a great way for us to work together, because as emergency use authorization, it's only government to government. And the private sector, I know how difficult it is to sometimes understand that you cannot just get the vaccine like right and left. Although I'm sure a lot of companies have attempted that. I'm sure there have been many requests that the companies, those who have the money will get it. But the government has come up with plans of having prioritization. Who are the most vulnerable? And that has been the frontliners for the Philippines. If you look at the e-learning in the DOH, it is there. The frontliners are the ones that are in the priority area level 1, because we all know that if the frontliners who are at highest risk of being exposed and dying, who will take care of the rest? And we know that these vaccines will not come in like, okay, we need 70 million people to be vaccinated. When can you get those 70 million to be vaccinated? It could be over 2 to 5 years. Right now, even the US are having difficulties getting their own vaccine, and they are actually the highest number of vaccinees right now. But it is important that we work together. And for companies, I think there is a tripartite. Yes, the companies have been given some sort of a leeway. Maybe you are going to donate. I heard that from Ayala. You're going to give the 50% and then you get 50% for your employees. But remember that there has to be a way of harmonizing this with the general prioritization, because otherwise yung sinasabi natin magkakanya-kanya tayo, it's gonna be chaotic, because the vaccine will come in trickles. It's not gonna be given to you in a silver platter. Everybody now is really scrumping for whatever we can get, and we don't know how many that would be. So this is really a lesson in harmonization, integration, and helping one another and supporting each other. Because otherwise, we're doomed. We
Yeah.
may not be able to survive this pandemic.
Thank you, Dr.
Over to
Bravo.
you, Kay,
I think
for
that's a good thing that he
Ayala.
called out. I think that's a good thing that he called out, Dr. Bravo. I think um, if you can say that the silver lining of this COVID-19 pandemic has really allowed for public and private sector to really work together in being able to provide not just access before to more testing facilities, but now access to vaccines. And you're right, Ayala is doing its best to be able to support the government in being able to aid in accessibility to more vaccines. No, and I guess for the benefit of the people who are in this call, although we also look to ourselves and also to our taking care of our employees and our teams and being able to protect them, no, and trying to revive our business as soon as we can, despite this new normal that we're adjusting to. But Dr. Bravo is correct. It's also being able to align ourselves with the government. So I guess as a discipline to ourselves, it will be good to follow also the prioritization that the government is trying to do. So even in our own companies in the private setting, we do have our own circle of essential or frontline workers that are continuously reporting to work every day and that we'd like to prioritize. And unfortunately, I don't think supply of vaccines will be enough for all of us at an instant. And that's why it's important for us to discriminate and be able to prioritize who will get access to it first. And then at the same time, also do not scrimp on the measures in being able to protect the workplace until today. So even if you're vaccinated already, it's important for us to continue advising our teams to imbibe the practices of social distancing, wearing of a mask, washing of hands. Hindi pa yun mawawala. The vaccine is not a one-time solution to protect us from all. So good for us to always promote that also in the workplace.
Thank you. Thank you so much, Dr. Bravo and Dr. Recto. I would just like to go very, very great points, and I will get back to that a little later. I would just like to recognize some comments here that we have. We have one from Miss Maricor Militante. May we be enlightened on the risk of allergic reactions from the vaccine, please? So anyone who would like to answer that?
Well, as a vaccine trialist, this is always what you do in a clinical trial. We always have to observe what happens after a vaccination. And it usually lasts for like the first 30 minutes after vaccination. That's when a severe allergic reaction can come in, what we call anaphylactic shock. And you must be always prepared for that because it can happen 1 in a million. But mind you, it's not only in vaccines that it can happen. Even antibiotics that are being injected to people, like penicillin. Do you know how many have died just from penicillin injection alone in the past, like say, 50 years of penicillin? And not just penicillin. Many antibiotics can also do that. Even dyes from x-rays, even some sort of, even aspirin, some of these antibiotics, anti-inflammatory. So, you have to be careful the first 30 minutes to 1 hour. And that's the reason why we need to be able to use trained vaccinator. You do not inject yourself, or you do not use, as we have heard before, some PSGs, saying that they injected themselves. That is really, truly unbelievable, and actually not recommended. That you just do whatever you please, because you need vaccinators who will be able to screen out those who need to be vaccinated. You have to screen. You cannot just inject everyone else. And of course, that will need some vaccinology essential knowledge, because not everyone, even doctors, will be adept or will be very knowledgeable about vaccination. It is something that you don't really take up so much in medical school. And because Kay is younger, maybe she can tell me whether in medical school they talked about immunology in relation to vaccinology. Because since time immemorial, that has not been a very, very well discussed subject in medical school.
So happy to share, Doc, that I think that we have included in our curriculum. We did study it, at least in basics of pharmacology and immunology. So there is some degree of appreciation already that not everyone can administer a vaccine, no matter how simple it looks. The good thing is that in clinical trials, as Dr. Bravo said, adverse reactions are being monitored, and that's why you don't see allergic reactions. Allergic reactions and adverse reactions are being monitored, and that's why it's good. It's good for us to appreciate that with usual vaccines, you don't see these allergic reactions happening left and right. But nevertheless, it's still possible. And that's why it's important that the vaccines are administered at the appropriate settings and also done by the appropriate health professionals. It cannot just be to Dr. Bravo's terms, any PSG or any layman administering it, because you'll need to be able to address it just in case there is an anaphylactic shock that happens, and you'll need to rush that person to an emergency facility, for example.
Wow, thank you so much for this very informative discussion. We also have here in the comment, Mr. Bong Ostero said that some experts say the mRNA vaccine makes the body work harder, since it does not limit the number of antibodies, and then thus mRNA vaccines are not advisable for older people and those with complications. So I think it goes back to what we said, what we discussed earlier. We have to really be careful. We have to read more, study more, and consult the experts, right? So I guess that's the key message there. Just to wrap it up, what I'm hearing
Fast.
Ma'am? Yeah. so fast. But Dr. Bravo, just and of course also Dr. Recto. Now we're going to the end of our segment. Any reminders, a message to our viewers as we continue to determine our best course of action in relation to COVID and the vaccination? Dr. Dr. Recto or Dr. Bravo, who would like to start first?
Kay first. I'll follow you.
Sure, but I think I guess I started my messaging already early. Na it's although there's so much progress right now with the vaccine development, and we do look forward to having this vaccine already in our own country and being able to get our essential workers and even our most vulnerable population already vaccinated. Nevertheless, I think the general guidance is that people should continue with the practices of social distancing, wearing of masks, um, being able to address proper workplace conditions so that people can be protected continuously from this. And to just be vigilant also in being able to monitor what's happening in the news and according to the right sources, to what Dr. Bravo was also speaking to. So we should stay informed. I don't think this is a time for us to just I guess shy away from all of this information. It's just important to handpick where we should get it from, because we should be smart about our choices, especially because we're handling more than just ourselves now, but our teams at work.
Right, right. Thank you, Dr. Recto. Dr. Bravo?
Yeah, following Kate, the reason I wanted to be following her is because I guess everything she said, I agree. But the thing is, you must remember there are many unanswered questions at the moment, and what may be right now may be completely wrong tomorrow or the next week or the next month. We are
Yes.
only in the early stages of vaccination, and every day there are news coming in from different parts of the world about vaccine. So you have to be, as I said, vigilant, and don't share news that may not be true, or worse, that may compromise our vaccine confidence. I've been working on vaccination for the majority of my life, and I'm 71 years old, and I have done a lot of vaccine trials in my 35 years of professional life. It has been a very important, complex activity. The unanswered question right now that we have to wait is how long the immunity will last, what are the rare adverse events that might come in any moment, what are the different rules for vaccine failure, because not all vaccinated will actually be protected. We know what are the risks for vaccine failure. Is it because your environment is so hot, your thermal stability? As I said, no one knows. And of course, how do we know whether it can really prevent transmission? Your efficacy does not say that you can prevent transmission. That's the reason why you need your mask and your washing and your public minimum standards. And last but not least, and I enjoin you to share with us anything we can do to improve and overcome this distrust that has been upon us since the last 3 years, where we lost vaccine confidence so much because of the fiasco that came in 3 years ago. I'm still hoping that everyone will really come out and help the government and help the vaccine advocates and help all the vaccine experts to really restore, build, sustain vaccine confidence so we will prevail and not be doomed. Thank you.
Thank you so much, Dr. Recto and Dr. Bravo. We really, really appreciate you coming to our show, and we hope we can invite you again next time. Thank you so much.